Well, good afternoon, everybody, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have 210,632 cases, 1,495 new cases reported since yesterday, 956 people in the hospital, and sadly, 3,532 people who have died. Our thoughts are always with those mourning a lost loved one or fighting this disease. Today, we're cautiously encouraged about where we are in this pandemic. The key indicators we watch in North Carolina remain mostly stable. But I have to tell you that we see warning signs that the disease could spike again, here and across the country. The virus continues to spread, so we must take the next steps methodically and responsibly. And we must rely on North Carolinians taking personal responsibility to protect others by wearing masks and keeping their social distance. Our top priority remains getting children back to in-person learning at school. This marks a major shift for many families now and in the coming months, as many schools open their doors, some for the first time since this pandemic. Our stability is fragile, and with cooler weather and flu season comes new challenges. While we are methodical and cautious about easing restrictions, we need to keep using proven measures, wearing a mask, waiting 6 feet apart, and washing our hands often. But before we discuss the next phase, I'll ask Dr. Mandy Cohen, our Secretary of the North Carolina Department of Health and Human Services, to walk through the data. Dr. Cohen.
Thank you, Governor. Those 3 W's are going to be critical to protect the progress we've made. So let's dig into the data. As a reminder, every week we look at a combination of trend metrics. We look at COVID-like syndromic cases, new cases, positive tests as a percentage of the total tests, and hospitalization. Together, these 4 metrics give us a complete picture of where we are today. And as you'll see in the data, we are stable, but as the governor said, fragile. In our first graph, we look at people who come to the emergency department with COVID-like symptoms. This is our earliest detection mechanism. Taking a look at the yellow line, you can see that this yellow line ticks up just slightly. This slight increase shows that we are at this fragile time and we have work to do to keep us on track and keep that viral spread low, and we really want to see this trend decline. Next, we look at new cases. This first graph gives you a look at the trajectory of new cases each day since we had our first case back in March. The yellow line shows our peak of cases back in July, then a slight bump in August corresponding to this reopening of universities and colleges, and then a decline to the cases at their current level. But let's zoom in to get a better sense of the current picture, particularly over the month of September. On the positive side, we are currently below our peak from July and August. However, you can see that when you look at that yellow line, our cases have leveled. While overall a leveling of this trend is a good thing, we want to continue to see our cases decline. We are seeing higher cases, particularly in the Northeast and Sandhills area of the state, but we all need to be working hard to prevent viral spread. Next, we look at the percent of tests that are positive. Here we see a positive trend. We have been at or just under 5% of tests coming back positive over the last 2 weeks. This positive trend is because of everyone's hard work. But you'll also notice the last 2 days, our percent positive ticked back up to 6%. So we must continue to work hard to keep our progress going. On our next graph, we look at day-over-day hospitalizations. You can see from the yellow line that this trend is level, and we maintain sufficient hospital capacity. So, okay, here's where we are. Surveillance data trended up very slightly. It gets a yellow line. North Carolina's trajectory of cases is level. It gets a yellow line. North Carolina's trajectory and percent of tests returning positive is level. It also gets a yellow line. And North Carolina's trajectory of hospitalization is level, but still high. This gets a yellow line. Now, to the capacity indicators. Regarding our testing capacity, folks are getting their results faster, and we're continuing our surge of no-cost testing events into October. However, we still want to see more testing being done, so this measure currently gets a sideways arrow. We continue hiring contact tracers to bolster the efforts of our local health department, and we've also launched our new exposure notification app, Slow COVID NC. So this metric gets an upwards arrow. Our PPE supplies remain stable, and we continue to distribute PPE across the state. However, the federal government is now paying for less, only funding PPE for healthcare workers, and not for places like school staff. So this indicator also gets a sideways arrow. Our steady, evidence-based approach has kept us from those dire circumstances other states have faced and has allowed us to responsibly ease measures. The day in, day out hard work of North Carolinians is making a difference. But, as I've said a few times, our progress is fragile. We cannot take anything for granted. Across the country, cases are beginning to increase again, particularly in the Midwest and the South. We're seeing a similar trend in countries around the world. So we're going to need to double down on our work to slow the spread of this virus to keep on the right track. The good news is we've seen what's possible when North Carolinians come together. We avoided the first and second peaks that much of the country, particularly the South, experienced. We can protect our progress by doing three things. First is practicing those 3 W's, wearing a face covering over your nose and mouth whenever you're with people that you don't live with, waiting 6 feet apart and avoiding large gatherings, and washing your hands frequently with soap or water or using hand sanitizer. Second thing, downloading the Slow COVID NC app so you can know if you've been exposed to the virus and can act quickly to protect yourself, your family, and your community. More than 80,000 people have already downloaded the app, so we're off to a strong start. And the third thing, things that you can do to protect your family right now, is get a flu shot. The governor and I got our flu shots last week. And remember, whatever your reason, get behind the mask. Thanks so much, Governor.
Thank you, Dr. Cohen, and thank you for your leadership. We're encouraged to see North Carolina holding steady, and because of our stability, today we're taking another careful step forward. North Carolina will move into Phase 3 beginning this Friday, October the 2nd at 5 p.m. So here's what'll change. First, our at-risk population is still safer at home. For those over 65 and those with health risks, we urge responsibility in your choices. For everyone, a face covering is mandatory for those over the age of 5. As the head of the CDC said, a mask is the single best tool we have against this virus. So in this new order, large outdoor venues with seating greater than 10,000 may operate at 7% occupancy for spectators with other safety protocols, as we previewed last week. Similar outdoor entertainment venues, like arenas or amphitheaters, may operate outdoors at 30% of outdoor capacity or 100 guests, whichever is less. Movie theaters and conference centers may open indoor spaces to 30% of capacity or 100 seated guests, whichever is less. Bars may operate outdoors only at 30% of outdoor capacity or 100 guests, whichever is less. Outdoor amusement parks may open at 30% occupancy. The limits on mass gatherings will remain at 25 people indoors and 50 people outdoors. The 11 p.m. curfew on alcohol sales for in-person consumption in locations such as restaurants and now outdoor bars will be extended. Phase 3 continues our state's dimmer switch approach to easing restrictions, and it will be effective through Friday, October the 23rd. I believe that North Carolina can do this safely. But so I'm clear, every gathering carries the risk of spreading this disease. Being safe means being smart and making sure others around you are doing the same. If you're still at high risk, you're still safer at home. If you're going out, do what works. Wear a mask, keep social distancing, wash your hands often, and don't patronize or go to places where people aren't doing that. Until we have a vaccine or a reliable cure, precautions like the 3 W's are with us for a while. Our children can go back to school, and our economy can fully rebuild when we're safe and people have confidence that they can stay healthy. Every careful step we make forward, and every time we wear a mask and keep our distance, we are helping to keep this disease at bay and building a stronger North Carolina. Along with Secretary Cohen today with me is Emergency Management Director Mike Sprayberry. Nicole Fox and Brian Tipton, our sign language interpreters, are with us today. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We thank the media for being with us today. We'll take questions now, beginning with the first one. If you can identify yourself and your organization, we would appreciate it. Thank you.
Our first question is from Dawn Vaughn with the News and Observer.
Hi, it's Dawn Vaughn with the News and Observer. Thanks for taking my questions. I wanted to ask about the percentages and a little more details about why exact the 7% as opposed to 8-9% in the bigger venues and then 30% for others.
Well, first, we know that these arenas, it's important for people to keep their social distance. You know that when you get that many people together, if you have 3,000 or 4,000 people, which could be 7% of a larger arena, that if they all go together in one place, then that could be a significant problem. So not only do we have the 7%, which is a low percentage, but enough room to keep them safe and to keep them socially distanced, we also have safety protocols to go along with it. I know the Panthers and the Department of Health and Human Services have worked a lot on this, and I think one of the plans that they presented was around that figure, and it looked good and it looked safe for everyone. And I think that that was determined to be a good number for these sizes of arena because we want people to keep their social distancing. We don't want them to gather in one place. We want people to be safe. We're trying to make sure we're using this dimmer switch approach in order to gradually get things back, but also protecting from the spread of the virus. You got anything to add to that, Dr. Cohen?
Next question, please.
Follow-up, Dawn Vaughn, News and Observer.
Hi, thanks for taking a follow-up. On the dimmer switch and this end date of October 23rd, do you want to continue phases by numbers or just make it a longer range and then decide when it's time as far as this exact time frame of different phases and the changes that makes? And also, how much longer do you think the mask mandate should be in place?
Well, the second part of your question first, as I said earlier, I think the mask mandate is going to continue to be important until we have a vaccine or a cure to this virus. I think it's going to be important to protect the population. But I also think on the other part of your question that we will take these 3 weeks to examine the science and the data like we always do, and then make decisions as we get toward the end of this 3-week period about what more North Carolina may do. We made this 3 weeks because we know we're getting into cooler weather. And Dr. Cohen has expressed her concern about the potential for increased virus spread. We're seeing some increases across the country, and we want to make sure that we keep this window short enough so that we can react. And we hope to make some decisions. I hope we can keep our numbers down and stable and that we can continue to move forward. But we have to do this very cautiously. Next question.
Next question.
Our next question is from Dewan Hogard with ABC 11.
Hey, Governor Cooper, Dewan Hogard with WTVD ABC 11. Thanks for taking this question. The first one would just be if we could get some more clarity with respect to movie theaters, you say 30% or 100 guests. Is that overall or is that per screen? And then secondly, maybe a question for Dr. Cohen as we approach Halloween. Any new guidance as if things progress the way that we would like them to, Halloween would fall after the end of phase 3?
It is 30% per movie screen with also a 100-person cap, whichever is less. And there are safety protocols, guidelines put together by the department to make sure that people are safe and that you don't have gatherings in the main parts of the theater. I'll let Dr. Cohen address the Halloween issue.
Hi, Dewan. Our department put out guidance related to Halloween at the end of last week, so you can go and check out that guidance. But essentially, Halloween's not canceled, but like many things this year, it's going to have to look a little different. And I think it's the perfect opportunity as you're thinking about what you want to be for Halloween. Think about how you're going to incorporate certainly a face covering or a mask as part of that costume. And it's going to hold the same principles. We want to make sure that people are wearing a mask, waiting 6 feet apart, and washing their hands. So when you think of a traditional go door-to-door trick-or-treat, I think that's going to have to look a little different. And we gave some different kinds of options that folks can think about, whether that's a candy hunt in someone's backyard, or there are ways to more safely put candy out so that folks aren't dipping their hands into the same bowl that others might be. So there are options in there to lower everyone's risk. What I will share, as I always do with folks, is that you need to evaluate your own risk as a family and make sure that you're doing things to protect yourself. It doesn't eliminate risk. We can only lower risk. And we do hope that folks do look at that guidance and do some of those lower risk activities. Particularly what I am worried about is parties that are indoors. So again, the governor just spoke in his executive order about mass gathering limits. We don't want to see more than 25 people indoors, 50 people outdoors. Again, that is because we have seen over and over that this virus can spread easily in groups of people. So there's a way to enjoy Halloween. I'm certainly looking forward to that, but we just have to do it a little bit differently this year. Thanks.
Thank you. Next question, please.
Our next question is from John Downey with the Charlotte Business Journal.
Yes, this is John Downey with the Charlotte Business Journal, Governor. I have a non-COVID question. Do you have any reaction to the published reports that NextEra Energy is interested in buying Duke Energy Corp?
I haven't read the article on it. I heard about it today, but what I will say is that North Carolina is proud to be the home of Duke Energy, which is a Fortune 50 company. Duke has been an important partner in our economic development and right here at the Emergency Operations Center in disaster recovery. I'm also pleased with Duke Energy's response to my clean energy plan that I put forward in Executive Order 80 and our commitment to clean renewable energy. Duke's commitment to clean energy will set an important example, and it will help us move our state forward to a stronger clean energy future. Next question, please.
Follow-up, John Downey, Charlotte Business Journal.
Yes, you said you had not seen the articles. Do you have any independent information that indicates that offer may be out there?
I don't have any indication on that, no. Next question, please.
Our next question is from Brian Anderson with the Associated Press.
Hi, Governor. Hi, Dr. Cohen. Brian Anderson here with the AP. I have a question for each of you. First, for the governor, can you commit to reopening schools that have students between the grades of 6th and 12th? We know K-5 is there, but is there any sort of timetable on grades 6 through 12 specifically? And Dr. Cohen, I didn't hear any green really, and I didn't hear any red in the trends you were presenting. Do you agree with this decision to move to phase 3 that Governor Cooper has come to?
Well, in the schools, it is our top priority to get all of our students back into in-person learning. It's as we move through these phases, we're continuing to keep that as the main priority. Already we've given that option to make sure that everyone can do that in K through 5, but each community has different levels of virus spread, and they need to make these decisions themselves. Don't have a timeline on it, but just know that it remains a priority for us. Dr. Cohen?
Thanks, Brian, for the question. And we are taking cautious steps forward in this next phase. I think it's why you see with every venue that we are opening that there are both capacity restrictions, masking restrictions, social distancing requirements. So I think it is a thoughtful step forward. But our trends are fragile. I think that has been the theme of what I was sharing today with our trends. We are stable but fragile, and I think it means that we need to continue the hard work that we're doing. So we need to make sure that everyone recognizes that they have a part to play in this, whether it's following the 3 Ws, getting your flu shot, downloading Slow COVID NC app. So we have work to do as we go forward, but we need to balance as we move forward here. We want to balance being able to continue to make progress as well as hold down this viral spread. And we can do that when we work together. Thanks.
Next question, please.
Follow-up, Brian Anderson, Associated Press.
Hi, Governor. I'm just curious, how will you be voting this election cycle? And if it's by mail, what degree of confidence do you have in that process?
So first, I have confidence in the security of our elections. And I know the State Board of Elections is working hard to make sure that our elections are safe and secure, that everybody has the opportunity to vote. Right now I'm planning, I think I'm going to vote early in person. That's the way that I usually do it, and Kristen and I will probably do that shortly after the polls open on October the 15th. Next question.
Our next question is from Richard Craver with the Winston-Salem Journal.
Yeah, yes, Governor. This is Richard Craver with the Winston-Salem Journal. And I was going to ask a question also of you and the Secretary. I guess, first of all, at this point with this limited introduction into phase 3, what do you feel like are the biggest challenges or biggest hurdles left in terms of what to reopen? Is it just the capacity, or is it a situation of there's still elements that you're still leery to reopen? And then the second question is, I'm sort of following up on questions from last week. Given the positive rate that has gone up in the last 2 or 3 days, have y'all seen any indications of any large events, whether it's the President Trump rally here in Winston-Salem or otherwhere, that might be contributed to that positive rate going up?
So first, I think we are concerned about indoor events and indoor gatherings, and it's one of the biggest issues that we have. Obviously, outdoor gatherings, there's less risk. There's still risk there when people stand close together. They don't have masks, but there is more of a risk inside, so that will be a challenge. The other challenge is just getting every person to do his or her part. We really could beat down the spread of this virus if everyone had personal responsibility, was careful and cautious. Then we can move a lot faster when that happens. We can make it easier to get our children in school safely, make it easier to ease these restrictions, and make it easier to stop the spread of this virus. I know that we look at the positivity rate, just like our other indicators. We try to look at them over a 14-day period. So we've kept this thing around 5%, which is where Dr. Cohen wants to be, 5% or lower. Yes, the last couple of days we've been up to 6%, or a little over 6%, but that's one of the reasons why this whole thing is fragile right now, is because we know that as we move into the fall and winter that we may see an uptick. Dr. Cohen, would you want to comment on that?
Thanks, Richard. First, I do want to reiterate what the governor was saying about the distinction between indoor and outdoor. And I think as you see moving forward in this cautious way, that we are promoting things that are outdoors if they are higher risk activities. So the things that we still think are challenges are indoor gathering type activities. Those are going to be activities that continue to bring with them a risk of viral spread. And that's, again, why we go back to the things that we know we need to do. Follow these restrictions, wearing your face coverings. In addition, I think we are also seeing that there is spread of the virus even amongst family members, and particularly extended family. And it's why when we talk about wearing your face covering, we want to make sure that you are wearing it anytime you are not with the people who are directly with those whom with you live. So I think folks let down their guard a little bit if it's their close family or extended family, close friends. And so we just want to make sure everyone is remembering that. We are particularly seeing when folks get lax on doing the 3 Ws, wearing masks and staying socially distanced, that is when we're seeing spread of this virus. It can be in restaurant situations, it can be in religious settings. So we want to make sure that in all those settings we are truly abiding by the restrictions that are in place. It is meant to keep the virus level low so that we can continue to do these activities, but just do them in a modified way to allow us to both open things as well as keep that virus spread low. Thanks.
Next question, please.
Follow-up, Richard Craver, Winston-Salem Journal.
Yes, the follow-up question I had is that given how crucial North Carolina seems to be in terms of the presidential election, the U.S. Senate, and the like, have y'all been able to communicate and get, I guess, some cooperation with whether it's President Trump's campaign, Vice President Biden's campaign, Senate campaigns, in terms of adhering to the mask requirements, the mask gathering requirements, and things like that y'all had started initially talking to a few weeks ago?
We're continuing to urge everyone, political candidates, people who have business meetings, to comply with the executive orders, the mask mandate, the mask gathering limits, just to save lives and protect people. I don't know about specific conversations. Dr. Cohen, I don't think she's had any specific conversations, but we've been pretty clear that that's what we encourage them to do, and we're going to keep encouraging them to do that. Next question, please.
Our next question is from Sharon Van Zwieten with Spectrum News.
Good afternoon. Excuse me, Governor. Illinois this week decided to go backwards and close indoor dining and make other changes because its positivity rate jumped. What kind of a positivity rate jump would North Carolina consider to further shut down what is open?
One of the reasons that we are moving cautiously forward is that we don't want to go backward. We would not tie it to any one indicator. As we said all along, that we're looking at levels of positive cases, that we are looking at percentage positives, that we're looking at our hospital capacity, that we're looking at our testing capacity. We have several indicators that we look, and a combination of those indicators would tell us what we need to do next. It's something that potentially could happen in order to protect the health and safety of North Carolinians. That is our #1 priority. But one of the reasons why we are moving cautiously, and we are continuing to encourage people to take personal responsibility and to be careful, and for these restaurants that are open, for customers and waiters and cooks and everybody to abide by the safety rules so that we can go forward and so that we don't have to go backward. Dr. Cohen, you want to say anything? Okay. Next question, please.
Follow-up, Sharon Van Zwieten, Spectrum News.
Governor, after last night's debate, a lot of people are questioning if that remains a relevant method of campaigning and reaching out to voters at this time. Do you plan on doing any debates, and how will this shape your campaign?
Yes, we have a debate. I have a debate scheduled, I think, October 14th, and do plan to take part in that debate. Hope we'll be a little nicer to each other. Next question, please.
Our next question is from Travis Sane with WRAL.
Yeah, hi, thanks for taking the question. Dr. Cohen, in some states, we've seen contract tracing efforts lead to the release of kind of a rundown of an example of how the virus spread, describing super spreader events. And what I'm wondering is, have we had any super spreader events in the last couple of months? Is that one of the primary ways this is moving now? Is it more, as you said, between family members? Can you kind of give us an idea of what our contact tracing is telling us specifically about how this virus is most likely to move right now?
Travis, thanks for that question. The virus moves in a number of ways. As I was mentioning before, it tends to move actually for folks who are in extended family, close family, and friends, right? So again, I think folks are letting down their guard when they're with their extended family or friends. And again, why it's so important to make sure you're wearing your mask, not just when you go to the grocery store, but even when you might get together with those closest to you. The other places we continue to watch are in congregate living settings, whether that is a correctional facility, a long-term care setting, a homeless shelter, a farm worker living area. So those are places that we're going to always continue to work on. I think we've made a lot of progress, but anywhere that that folks are living in closer quarters, that virus is going to spread. I think the third category are those kinds of gatherings that you've mentioned, and many of our local health departments have put out information about these events in various ways, whether that happened at a restaurant or a religious setting. We've seen it obviously at our universities in higher ed, sometimes in a dorm, sometimes in a off-campus housing. So those are the ways in which we're really seeing virus spread. We've learned a lot about this virus. What we know is that the risks are greater indoors than outdoors, so that's one. The risks are greater when you do have a lot of folks together because there are certain events that cause virus to spread to a lot of people all at once, and then it seeds even more people. So that's a concern about bringing people together. And it's why those 3 W's map to exactly the way in which this virus spread. And that's why you want to be wearing a mask, waiting 6 feet apart, and washing your hands. That's a tried and true way in which we're going to live with this virus, but still allow us to make progress as we were talking about today. Thanks.
Next question, please.
Follow-up, Travis Sane, WRAL.
Thanks for the follow-up. I want to make sure I'm understanding the outdoor bar restrictions. They're fairly complicated. I'm assuming there are a number of bars that have not had outdoor seating before and thus do not have an outdoor occupancy capacity. Am I reading this correct, that in that case, they would be limited to no more than 7 customers for every 1,000 square feet of the outdoor area?
Do that.
Hi, Travis. That's exactly right. We recognize that outdoor capacity is not always a thing that someone is zoned for. And so, yes, we sort of have a proxy for what does about 30% of a space look like. And so that's how we came up with the 7 per 1,000-foot guidance that you see in the executive order today. That's exactly right. Thank you.
Next question, please.
Our final question today will be from Derek Dellinger with Fox 46.
Thank you for taking my question. This is Derek Dellinger with Fox 46. We've spoken with bars and at least a couple of other businesses that say that they've gone into debt just to stay in some semblance of not entirely closing. And they say even reopening with restrictions, it's not enough, and they're on the verge of collapse or have collapsed. And whatever help that they've been getting simply, they say, is not enough. Is there any additional help that the administration or that you want the legislature to do to further offset the losses that they've seen?
So we asked for some significant funding for our small businesses to help them with paying their debts, their utilities, their rent, their employees. Money has been put forward for that, and applications are ready to be taken for that. But I asked the General Assembly for more than they ended up appropriating. We need to do more for these small businesses. We need to help them in several ways. We need to provide assistance for them, but we also need to work hard to slow the spread of this virus, because a lot of businesses, or most of North Carolina is open, and a lot of businesses don't have enough customers because people don't feel safe enough to patronize them. And what we've got to do is to lower the spread of this virus so people will feel safer. And that's why I mentioned earlier that that's the way for us to really get our economy fully going, is to deal with this pandemic. Let's don't pretend that it doesn't exist. It's out there, and it's making people sick, and it's killing people. And we have to step up and do what we need to do to slow the spread. That's going to be the way we save lives. It's also going to be the way that we continue to push our economy forward. Thanks very much for joining us today, and stay safe out there, everybody.